Hello, Faisal. Good afternoon.
Afternoon.
Just for those who are listening and watching, I'm Eszter Kismodi, Chief Executive of Sexual and Reproductive Health Matters. And I'm here today with Dr. Professor Faysal El Kak, Director of the Women Integrated Sexual Health Program at the American University of Beirut, the President of the Eastern Mediterranean Federation of Sexual Health of WAS, also Editorial Advisory Member of SRHM, and very dear friend and colleague. And Faisal, you are in Beirut, in Lebanon, and we just thought that it would be so important to get some first-hand information of what's going on with the sexual and reproductive health, human rights situation in Beirut. But first of all, thank you so much for being here. And how are you, Faisal?
Thank you very much. We're living under conflict. This is a very one of the most cruel conflicts. We've been subjected to bombardments, airstrikes over the past 3 weeks, and that's on a daily basis. That's on hourly basis. There are so much miseries going around. There is so much death, so much casualties, so much displacement, and people are trying to help as much as they can, and it just keeps on getting more damaging, getting more painful, getting more bloody, and in these situations, you don't have much choices. The only choice you have is to stay safe and to stay focused and to try to help as much as you can.
Thank you so much for being available for this call. Faisal, you are working as a physician beside your academic engagement, and you told me that you are doing training in this situation. You are working as a physician on the hospital. You are part of the relief team. What's happening with the health and sexual and reproductive health situation in these 3 weeks and right now?
Esther, what happened, it was so fast. So the conflict has moved from what they call in the military language controlled retaliations into like kind of all-out war, kind of reaching Beirut city, reaching other cities on the other side, and but that was happening fast, and in that sense, we had a massive displacement internally. Until today, it's 1.2 million people over, like, you're talking 10 days. And that's huge in view of very suboptimal preparation on the side of the government in terms of shelters, in terms of all the necessities of basics, food, mattresses, clean water, health access. Those are all compromised, and there was not really a proper preparation for that, because people thought this is going to be within the controlled measures and there won't be like massive all-out war and all-out conflict. So you can see people filling schools, filling churches, filling mosques, people on the street, people on the open areas, in parks, in squares, people even leaving to Syria across the border, the eastern and the northern borders with Lebanon. Today, the reports indicate 400,000 left to Lebanon, and there are estimation of around 200,000, 200,050 are in shelters. Of course, the others are with their families, others with friends, others are in other places that are not registered by the crisis response. So there is this whole massive movement of people who left suddenly. Yeah, like some of them, they just left on the spot, leaving their possessions, leaving their stuff, leaving many things behind. And that burden is immense. And on the health itself, of course, is a lot in women's health, young women, sexual reproductive health, interruption of care, menstrual issues, infection issues, poor hygiene, interruption of pregnancy care, all the vulnerabilities of abortion and loss of the pregnancy, all the women with chronic conditions that are receiving medications, all women who are cancer survivors that need to take the medications. All these are suddenly interrupted, and we're trying to just get our heads around, fixing some primary healthcare centers, fixing access, visiting the shelter centers, trying to provide something as health teams. I've been engaged in training frontliners on danger signs of pregnancies, danger signs of infections, issues of hygiene, issues of avoiding unintended pregnancies, issues of harassment, and all the matters around SRH under conflict. It is very difficult. It's very tough. So we'll try to do our best how to mitigate the effect of this horrible conflict and war. And some hospitals are out of work.
This is what I wanted to ask, Faysal, that what's happening with the establishment, with the health workforce, the supplies. What is the situation? I guess it's
according to the WHO, close to 100%, 100 healthcare workers lost their lives. 6 hospitals are out of work, out of function. And for the supplies, you still have some, but the issue is with the interruption.
Yeah.
There is no lots of reserve that can go for a month or 2. So there are interruption of care. There is an access issue. And many of the families are conservative families. They don't know their way around. They sometimes probably are not in the habit of going alone to the center and visiting and stuff. So the whole thing is disrupted, from the supply chain to the access to the care provision. And we are still in the very beginning, still in the acute phase. Because if you look at the how these matters are described in a humanitarian setting, we are still in the acute phase. People are still moving and leaving. We started with 200,000. Now we are 1,200,000. And probably I think we're going to have additional 300,000 in the coming 1 week.
And Faysal, you mentioned that Lebanon has been hosting or have been hosting 1.2 million refugees, and one of these refugees who was seeking refuge in Lebanon prefer to go back to Syria now because
they are doing this exactly. I don't know how you call this, but I mean, sadly, sarcastically enough, they escaped the war from Syria, came to Lebanon. Now they are moving again. So people keep on being displaced. So now they're going back to Syria, along with many Lebanese. So the total now estimation, as I told you for today, is probably 400,000. Half of them probably Syrians, half of them Lebanese, or at least 60% Syrians. So they're moving back because the amount of bombardment, airstrikes is, and people are moving not because also their homes are destroyed, because also you cannot stay in a war zone with all the kids around and all the shortage of, so you have to move to safer places. You have to move to some places where you can find basic supplies, you can find healthcare, and you can keep your family away from all these sounds and traumatic events of airstrikes.
Faysal, I listened to an interview with the ex-president of Lebanon today morning, and he said that it feels, being in Lebanon, that Lebanon is a forgotten nation for the world suddenly in this. You told me that, Eszter, how am I doing? It's my ninth war or something, but every war is a new war. Today is today. I mean, what do you need? What is the assistance? What is the preparation? I know that you are extremely well connected with international agencies, but what is the need? What beside of importantly stopping this war, but what is the assistance that is needed?
Definitely, an immediate ceasefire is very important and is very much needed. Politically, I think people are still, some people, some governments, they still care for Lebanon for different reasons. But you are in the middle of a very multi-layered, complicated political situation in the region that has a lot of religious and a lot of cultural and a lot of justice components and a lot of history and a lot of blood. And there are so many levels for this. It's very complicated. Of course, sometimes people are very busy as governments in many other things going around, but Lebanon still, I mean, being supported by some international and Western countries and other countries at the political level, at the UN level.
And the health
some countries, sorry?
From the health system perspective, Faysal, we talked about that in terms of.
Now, some countries are sending some aid from neighboring countries in the Gulf. Other countries promise to send some aid. What you need now, I think, from my experience in this crisis and from before, you need to provide the basics. You don't have enough mattresses. You don't have enough shelters. You don't have enough latrines, enough clean water. These basic stuff, packages of dignity and hygiene. You have to find shelter because you still need at least 400 more shelters to take people away from the streets and from the parks, the public spaces, into basically decent shelters. Now it's still sunny and 22, 24, but we're in October. Anytime you can get rain and you can get cold, and people have to go indoors and inside. So you need to have all these, I don't know what, prefabricated tents with basics. You need supplies, as I said, of mattresses and of basic hygiene and things. And of course, medications, basically the medications for chronic conditions like hypertensive, diabetes, birth control, long-acting reversible contraceptives, cancer medications, first aid stuff for syndromic infections, whether they are reproductive infections and others. So this is the kind of levels of support that you need to have. But people on the street, I mean, this is for me, this is a huge problem that we have to take care of. Hopefully, some countries promised. We'll see how things will develop in the coming 48 hours in terms of that. Some countries promised to have an airplane bridge bringing stuff continuously. So we'll see how it goes. But the amount of need is very huge. And the people who are volunteering and mobilized on the ground is really less than the expected. and doesn't meet the need. Although the mobilization of the communities and the civil society is very impressive, but there is so much need.
Thank you so much, Faysal, and please receive all our solidarity and warm hugs, and you are in our thoughts every day, every hour, and thank you so much for.
I appreciate, and I hope you also carry our voice in seeking an immediate ceasefire and start working with the diplomatic and political process.
Thank you very much, Faysal. Take care.
Thank you. Bye-bye.